Historic Ybor City presented by Melody Bidding and Julia Parchuke. These are the listed objectives for this presentation. Ybor City is a National Historic Landmark District in Florida and one of the oldest communities in Tampa. It is known as the first industrial town that was established by Vicente Martinez Ybor in 1886 with the opening of his cigar factories. It was also known as a settlement community for immigrants that came from various other countries. Ybor City continued to grow and thrive from its conception in 1886 until the 1930s when the economy declined during the Great Depression. Historic preservation began in the late 1970s, and by the 1980s, Ybor City had become renewed. Today, there are more than 950 historic buildings and structures that remain intact, preserved, and in use. There is a variety of adequate housing choices to meet the needs of this diverse population, including century-old bungalow and Victorian-style homes to newly built modern homes and condominiums. The average purchase price of a home in Ybor City is approximately $82,000, which is 47% lower than the surrounding Tampa Bay area. And the average monthly rent is approximately $800, which is 16% lower, which makes owning a home or living in Ybor City affordable. There are also 2 low-income tax credit apartments, and Ybor City also offers Section 8 housing. Educational opportunities for all age groups are available. Several of the public schools are magnet schools, which attract and offer students from other communities the opportunity to participate in a specialized curriculum. Benefits of attending a magnet school include improved cognitive skills, social and emotional benefits, improved preparation for adult functioning and employment, increased engagement within the community and the political functions of the world. Library resources in Ybor City are abundant, offering 2 county public libraries and the community college library. According to the CDC, higher education and income levels are important to improve health in individuals and assist in lowering rates of chronic diseases. The city offers safety and protective services from the Tampa Fire Rescue Station 4 that provides emergency medical services and fire rescue, and the Tampa Police Department and the Hillsborough County Sheriff's Office that provide protective services to the community members. Mayor of Tampa, Bob Buckhorn, allocated the largest portion of the 2017 fiscal year budget, $240.3 million, to the Public Safety Fund. According to Maslow's hierarchy of needs, safety and security is a basic need that must be fulfilled before psychological and self-fulfillment needs can be met. Local churches provide spiritual well-being to the community members by providing church services, local community outreach programs, and children's programs. Recreational activities are scattered throughout the community and all within walking distance. Physical activity is an important part of maintaining a person's health and well-being both physically and mentally. Therefore, it is important, especially in lower poverty areas, to have access to at least 60 minutes of exercise per day. Central Ybor provides sidewalks for safe commuting and exercise. There are historic museums that explain the history and preservation efforts of the community. Historic preservation creates tourism through festivals, art, and other activities that occur in the area, but it can also help conserve the community's resources and energy efforts, control waste, strengthen the community and the economy, and increase quality of life. There is also a variety of free community support centers that offer food, clothing, counseling, temporary cash assistance, and various other resources for those in need. Community support services are especially important because the median household income is only approximately $24,000. Community support services can assist vulnerable individuals and families with health promotion, disease prevention and management, social support, respect and compassion, service coordination, and accessible health care. According to the 2010 census, this district has a high rate, 17% of persons over the age of 65 years old, as compared to the Hillsborough County rate at 12%. The community also has a high rate, 20% of persons that are Black or African American, as compared to the Hillsborough County rate of 17% and the state rate of 16%. Health concerns include hypertension, heart disease, cancer, and increased likelihood of needing long-term health care facilities. Because these services are not provided for in Ybor City, these health concerns must be sought out from neighboring communities. The CDC states that with decreased mortality rates comes an anticipated increase in the number of older persons that need public health assistance. This, along with an increase in chronic disease management, will put a further strain on public health resources in this community. This community also has a high unemployment and poverty rate, low education rates, and lack of access to healthcare services that heavily contribute to vulnerability and determinants of health. Various healthcare providers are available that accept Medicare, Medicaid, private insurance, and cash payments. However, primary healthcare providers that develop relationships with their patients are not available. Office hours for these facilities are limited, and they do not include nights or weekends. In addition, appointments are difficult to obtain with a short notice and wait times are lengthy. and there is only one small nursing home in this area. The closest hospital is located 2 miles outside of Ybor City on Davis Island. Healthcare disparities may occur because of the limited healthcare access and their hours of operation, as well as the difficulty in obtaining transportation to healthcare facilities outside of this community. The following Healthy People 2020 objectives were chosen for Historic Ybor City. Objective SA 13.3 is aimed to reduce the number of adults reporting use of illicit drug use during the past 30 days. This objective is important with the rampant use of substance abuse that occurs in Ybor City during the weekend and nightlife. Objective AHS 5.1 is aimed to increase the number of all people that have ongoing access to regular healthcare providers. This objective is necessary due to the lack of primary care, pediatric, and healthcare resources that are available. Objective AH 11.1-2 is aimed at reducing the rate of violent and serious property crimes for minors and young adults. Because of the high rate crime that has been previously noted in Ybor City, this objective is important to ensure the safety and security of all the community members and to encourage healthy lifestyle choices.
As you drive throughout the Ybor City, there are distinctive issues noted regarding the environment. The entertainment district maintains clean curbsides and sidewalks with good curb appeal. However, as you drive throughout the residential part of Ybor City, you will notice just the opposite. Houses are in depressed states, trash is littered throughout the neighborhood, stray animals, including chickens, roaming the streets. Trash receptacles are placed throughout the areas with garbage and recycling services available to the community. Because Ybor City hosts numerous special events such as Gasparilla Night Parade and Guavaween, gathered waste services are also offered by the city. An organization has been established called Ybor Environmental Services that assists in the cleanup of litter, structural cleaning of graffiti, alleyway and sidewalk cleaning, and landscaping. The YES program has a primary focus on the entertainment district and not the older established residential areas or public assistant housing. Air pollutants are a major problem for the health complications that contribute to diseases. As you drive down the main entertainment district, you will notice numerous bars, restaurants with outdoor seating, and numerous smoke shops with patrons smoking. This brings major worries for direct smoke and secondhand smoke-related diseases. Safety is of significant concern in Ybor City, and going alone, especially at night, should be avoided. Throughout the residential district, numerous people were seen loitering and hanging on street corners. The crime rate for historic Ybor City is 15% more than the national crime average, which poses concerns. There are many public officials that represent the community of Ybor City. One of them is Mayor Bob Buckhorn. There are numerous community meetings for citizens to attend and can be done in a variety of ways for their convenience, such as the City of Tampa live stream and in-person public meetings with meeting dates and times posted on the City of Tampa website. All these representatives have direct phone numbers and emails listed. During one of the City of Tampa budget meetings, there were numerous discussions about improvements to the town of Ybor. Some topics included a $3.1 million renovation to the Cascaden Pool and a $30 million investment in the nearby Perry Harvey Skate Park. Mayor Bob Buckhorn made statements that these improvements were important to the community to build exercise promotion, provide a means for the youth to stay out of trouble, and resources for the less fortunate to learn to swim. The 6 priority community problems are arranged in the following order based on Maslow's hierarchy. Because Maslow's hierarchy establishes that food, water, warmth, rest, security, and safety are basic needs before one can progress to the other phases. These prioritized community problems reflect the essential health needs in Ybor City. There are food resources in the area of Ybor City in the form of restaurants, fast food chains, limited fresh markets, and convenience stores. However, affordable fresh grocery for the residents needs to be addressed. Community health nurses must advocate for affordable healthy food choices, availability of healthy food items, and improved access to the quality of foods available. This will implement good overall health to improve the reduction of diseases that are associated to poor diet, such as diabetes and heart disease. Substance abuse is on the rise, and there are numerous businesses within Ybor City that contribute to this problem. Liquor stores, convenience stores, bars, and restaurants provide unlimited advertisements in their storefronts and supply abundant alcoholic beverages to visitors and community residents. Special events such as Guavaween and Gasparilla flood the streets with abundant alcohol access and promoting additional resources for at-risk behaviors. In addition, drug abuse is an epidemic with over 22 million people recognized within the United States requiring treatment for substance abuse conditions. There are resources available for detoxification such as DACO and the Youth Clinic of Ybor City, but resources must be implemented throughout this community for primary prevention such as educational resources and promotion of abstinence or responsible drinking. Because there are inadequate resources for medical care in Ybor City, this is an area of concern. Primary care physicians, urgent care, home health, and hospital resources are not immediately available, and the residents are required to go to neighboring and outlying communities for medical care needs. It appears that the healthcare cultural competence is lacking in this area by not having the required medical care to the diverse population and underprivileged community. Unprotected sex contributes to many sexually transmitted diseases such as gonorrhea, chlamydia, syphilis, and AIDS. All are identified as the 10 most communicable diseases in the county by the Florida Department of Health. Ybor City contributes to these health disparities due to the numerous gay bars, nightclubs, and hookup spots for sexually active adults and adolescents. There is an abundant amount of resources in the community to address these concerns, but because this is such a prevalent concern, primary, secondary, and tertiary prevention strategies must be focused on and increased. Crime in this community is widespread with high rates of theft, vandalism, residential burglary, robbery, motor vehicle theft, and shoplifting. Additionally, long response times for medical response services from Tampa Fire Rescue is a concern. With an achievement of 80% of total response time in under 8 minutes, this is an area that must be improved to keep the community safe. Per Maslow's hierarchy of needs, with safety being one of the components, is a vital concern for the community. One of the leading causes of death, according to the Florida Department of Health, is cancer. The abundant smoke shops, hookah bars, and cigar manufacturers line the Ybor Strip. Individuals that smoke are seen all over the community, and secondhand smoke is inhaled by bystanders, workers, and even children. Because smoking is considered the leading cause of avoidable death and leads to numerous diseases and disabilities, smoking cessation programs, education, community outreach programs, and awareness is drastically needed. The abuse of tobacco, alcohol, and illegal drug use is profound throughout our nation and costing more than $700 billion annually. Out of 17 nations, the United States ranks at the highest out of 17 countries in the abuse of cocaine, cannabis, and tobacco. Through researching other countries and seeing how substance abuse is being managed, there are many different views. There are also additional methods where other countries are utilizing alternative development programs such as Colombia and Philippines, while other countries are using preventative alternative support methods such as Venezuela, Denmark, and the United States. The community health nurse should intervene in this progressing epidemic by assisting the promotion of healthy lifestyles by increasing education and pride through school programs, facilitating curriculums with students against drunk driving, aiding and building skills against peer pressure, and assisting in decreasing over glamorization of drug and alcohol use by minimizing immoral advertising.
Thank you for viewing this presentation on Historic Ybor City.